Here we are, late in 2025 with respiratory season upon us. This year's flu vaccines are abundant and accessible for patients 6 months and older. The latest COVID-19 vaccines are available, and we have a vaccine and 2 monoclonal antibodies that prevent the worst impacts of RSV. We should be feeling ramped up and ready to roll, but instead, many of us are feeling overwhelmed, helpless, even powerless, because our patients are constantly being inundated with noise and narratives from all sides. I'm Dr. Todd Wollyn, Executive Director of the Trusted Messenger Program and a pediatrician with over 30 years' experience. I'm here to tell you there is hope. Our patients may not know what to believe, but they know who to believe. While trust in institutions and in science and in medicine overall has cratered since the pandemic, polling data continues to show that year upon year, there are no more trusted messengers in America than healthcare providers. A recent survey found that people's trust in their own primary care provider rose 10 percentage points in the last year alone. In fact, trust in my healthcare provider may be the only issue in America on which all sides of the political spectrum agree. When asked who they trust to tell the truth about medical issues and protect public health, respondents from the left, the right, and the center all rate my doctor as their number one choice. To make the most of that trust, we need a keen and sensitive grasp, not just on the clinical care, but of how best to communicate it. Studies have shown that when patients fail to follow provider guidance, the problem isn't the recommendation. It's how the recommendation was communicated. Better patient choices and better outcomes follow from better provider communication. A healthcare provider trained in communication is, simply put, a more effective clinician. We were trained to address viruses and bacteria, not false narratives, social media algorithms, and wellness influencers. We have work to do as a profession. In our schools, training programs, residencies, and continuing education, and as individual practitioners. The Trusted Messenger Program is here for the NFID and all healthcare providers, working to combat respiratory infections and all communicable diseases with the power of evidence-based communication. In a world of noise, uncertainty, and false narratives, our voices matter more than ever. We just need to get better at using them. It's what our patients need from us and for their health.